Mycoplasma pneumoniae, scientific name. Mycoplasma pneumoniae is a type of bacteria belonging to the genus Mycoplasma of the family Mycoplasma. It is the cause of mycoplasmal pneumonia in humans, which is a type of atypical bacterial pneumonia and is associated with cold agglutinin disease. Mycoplasma pneumoniae is characterized by the absence of peptidoglycan in the cell wall, which results in resistance to many antibiotics. The survival of the bacteria and infection in the body after treatment is related to its ability to mimic components of the host cell surface. Symptoms: Mycoplasma pneumoniae causes a range of manifestations, including atypical pneumonia, bronchitis, and upper respiratory tract infections. Atypical pneumonia is the most severe of these. Bronchitis is the most common presentation. About 15% of infections are asymptomatic and are usually found in adults. Symptomatic infections develop over several days and may be mistaken for other bacterial pathogens. Bronchitis is more common in children because of their poor immune system, and about 18% of affected children require hospitalization. Common mild symptoms include sore throat, wheezing, cough, fever, headache, rhinitis, myalgia, and malaise. Early treatment with antibiotics can reduce the severity and duration of symptoms. Death from pneumoniae is rare, and when it occurs, it is due to lesions and ulceration of the epithelial lining, pulmonary edema, and bronchiolitis obliterans. Extrapulmonary symptoms, such as autoimmune responses, central nervous system complications, and skin disorders, have been associated with pneumoniae. Infection in approximately 25% of cases. Treatment and prevention: most antibiotics used to treat pneumoniae infections target bacterial ribosomal RNA, including macrolides, tetracyclines, ketolides, and fluoroquinolones. Most of these antibiotics are taken orally. Macrolides reduce hyperresponsiveness and protect the epithelial lining from oxidative and structural damage, but they can only inhibit bacterial growth, bacteriostasis, and not cause bacterial cell death. The most common macrolides used to treat infected children in Japan are erythromycin and clarithromycin, which inhibit bacterial protein synthesis by RNA methyltransferase. Administration of antibiotics has been shown to reduce the length and severity of pneumonia infections compared with untreated cases. Neurological effects seen in children with complicated infections have been reversed with high-dose steroid therapy. The main reason for the difficulty in eradicating pneumonia infections is the ability of the bacteria to survive inside the patient's body, and the lack of a cell wall in pneumoniae, which makes multiple antibiotics directed at the bacterial cell wall ineffective in treating these infections. Therefore, pneumonia shows resistance to antibiotics such as beta-lactams, glycopeptides, sulfonamides, trimethoprim, polymyxins, nalidixic acid, and rifampin. Clinical samples taken during 2011 to 2012 in Ontario, Canada, identified antibiotic resistance rates in pneumoniae. Of the 91 drug-resistant pneumonia samples, 12.1%, carried nucleotide mutations associated with macrolide resistance in the 23S ribosomal RNA gene. None of the pneumonia samples were resistant to fluoroquinolones or tetracyclines. Doxycycline can be used to treat infections caused by Mycoplasma pneumoniae, which typically present with a persistent cough lasting several weeks and showing interstitial pulmonary infiltrates on chest X-ray. Vaccine designed for pneumoniae has focused primarily on preventing its attachment to host cells, which would prevent the onset of cytotoxicity and subsequent symptoms. To date, vaccines targeting the P1 adhesion protein have shown no reduction in the onset of infection, and some vaccine trials have resulted in worsening of symptoms due to immune sensitization. Recent experiments in mouse models have linked the phenomenon of worsening symptoms to immune sensitization due to lipid Molecules in the lipoproteins of M. pneumoniae. Introduction of peptides that block adhesion receptors on the host cell surface may prevent M. pneumoniae from adhesion. It is difficult to control the transmission of M. pneumoniae infection because of the period of infection that lasts several days before symptoms appear. The lack of appropriate diagnostic tools and effective treatment for the bacteria contributes to the spread of the infection. Myers and colleagues analyzed the transmission of M.